Can you completely prevent heart attacks and strokes through diet and lifestyle?
We have to recognize that there are some genetic abnormalities. People who have heterozygous familial hyperlipidemia, that is, their cholesterol is really high, it's genetic, they have one of those bad genes, they're going to occur with 1 out of every 250 or 500 people. And they are going to have a very, very high cholesterol, typically an LDL cholesterol greater than 190. And those folks, if they aren't really upfront and addressing this genetic abnormality, they could have, even with a healthy lifestyle, they could have a heart attack or a stroke from blocking their arteries with cholesterol. And so it isn't exactly true to say that you can completely prevent heart attacks and strokes. However, for the vast majority of us, those of us who are not, should we say, well, we're all mutants. If everybody has mutations genetically that occur, and we're all a little different. But for the most part, we actually can avoid our heart attacks and strokes by keeping the blood pressure down, by making sure that we're not overweight, diabetic, making sure that the cholesterol is low, that you're doing a plant-based diet, that you're exercising somewhere between 150 and 300 minutes per week, and not smoking. Now, there are other negative things, such as the data on smoking marijuana. It's been legalized in so many places, including the state of Illinois. I would just ask the state legislature in every place to just put the words into their search engine, marijuana stroke, and they'll see that it's one of the leading causes of stroke in younger people. Cocaine would be another one causing heart attacks, and that's obviously more famous because of basketball players who died suddenly doing cocaine, and it's a real issue. So there are issues other than diet and exercise that people do that can cause heart attacks and strokes. But if we were to avoid substances, substance abuse, do a healthy diet, and have an exercising lifestyle, we really should be able to reduce, if not eliminate, the majority of our heart attacks and strokes.
Do we need some dairy products to stay healthy? Do you recommend plant-based milks like oat, hemp, soy, coconut, almond, cashew, flax, etc.?
So I know I would disagree. There's some people who would say that no one needs any dairy product at any point. Well, if you think of milk as a dairy product from this, regardless of which animal it comes from, then we were all pre-programmed to have our own species dairy products. Okay, and the need for that goes down with age. People who have looked at it carefully understand that when there are very few times in our planet that one species of animal will take the milk from another species of animal. Humans do this, and it's very much to the detriment, mostly because of the saturated fat, the cholesterol. The lactose causes some gastrointestinal disturbances in many people, but I would say one of the more concerning issues would actually be the growth hormone. And that growth hormone excess makes people bigger, and it makes you bigger in places that you really don't want to be. And so when we're talking about cow's milk, the ability to take a baby cow and turn it into a 1,500-pound animal pretty quick is something that milk is capable of doing, and that's not something that we should be doing for ourselves. So but to answer the question directly, when you look at long-term food frequency questionnaires and compare it to death rate and the cause of death, all-cause mortality, cardiovascular, cancer, what you find is that dairy, in most of these studies, are actually detrimental. It may not be as detrimental as eating red meat, eggs, or processed red meat, but it's still detrimental. And so something that people should try as much as they can to replace those milks with, the types of milks that have less in terms of saturated fat and cholesterol, and those are the oat milk and almond milk and soy milk and the like.
Do you recommend statin drugs? Some have said statins contribute to diabetes. Do you agree?
I would say that statins contribute to diabetes. Absolutely. That's been very clearly shown. It also has been shown that that it actually can decrease the death rate in the diabetics so much that it seems like a risk benefit that you would never want to accept. But let's look at that data very carefully. Okay. It turns out that it's the highest dose of statins. And interestingly enough, we do recommend the highest dose of statins that people can get their hands on for most of the conditions that actually need a statin because the outcomes are better. That is, the high dose is better than the moderate, moderate better than the low dose, and low dose better than none. And those studies, people can just look at that again through a search engine, put in statin mortality, you'll be shocked. And if you are at risk for a cardiovascular event that's preventable, you should go and be on a statin if your doctor says so. Now, the fact of the matter is the diabetes that happens that is statin induced tends to happen in people who are about to end up diabetic anyway. That is so-called metabolic syndrome, typically centrally obese. Have I seen the blood sugar go up in people who are thin and otherwise healthy? Yes, but you never quite to a diabetic level in those folks. So if you're taking care of your lifestyle and you are actually thin around the middle, this isn't much of a risk and you have the benefit. Now, what's our other big risk of statins, to be honest, is breaking the Medicare trust fund. So this is a very tenuous situation. You could not have done a lifetime life expectancy calculation back in the 1980s, funding the Medicare system in the 60s and account for statins. Statins don't cure anyone, and it lengthens their life significantly. So if you're the payer, that's your worst financial nightmare. That is something that will not let someone come off of the rolls because they died, and yet they're still ill and taking up resources. That's what our Medicare system is for. I worked for Medicare for 4 years. They don't look at it that way. They look at it as an opportunity to help the population. They take it very seriously. But statins are really making them struggle. And when people say they're not going to do statins, I kind of tease them saying, so you're trying to do the government a favor. Because there are so many conditions where if people would just look up, stroke, heart attack, and look at the difference in outcome with and without statin, the differences are very striking. Now, can you replace that completely with a plant-based diet? Because that's really what's underlying this question. That is, what can you do instead of statins to lower your cholesterol, lower your inflammation, which is the main effect of statins? If your LDL and your C-reactive protein go down, aren't you in a better state? And yes, you are. Can you do that with diet? Absolutely. Is it enough? Well, in some people it is, but if you're talking about someone who has multi-vessel coronary disease, that triple bypass surgery, that sort of thing, you're going to need all hands on deck. And so you should be doing a whole food plant-based diet, an exercise program, and all of the medications that the doctors actually are recommending for you to give you your best outcome.
Do you recommend bariatric surgery?
It's interesting that bariatric surgery does have beneficial cardiovascular effects. Wouldn't it be nice if everyone followed Dr. Garth Davis? He's a Texas-based bariatric surgeon who has written books on plant-based nutrition and spends the majority of his practice, as I understand it, trying to talk people out of the very surgery that from which he makes his living. And why does he do that? Because he knows that this is actually better for people. Every surgery has some complication. Every surgery is going to have its side effects, even when it's successful. And I remember the original bariatric surgery, which people have improved dramatically, the ileal bypass surgery, where people would have 20 bowel movements a day, and they would just pray to have the surgery taken down so they can go back to a regular lifestyle. Well, one of the best ways of dealing with this is to start with healthy lifestyle at a young age and never get to the point where you have the so-called morbid obesity that would require bariatric surgery. The best part of bariatric surgery would actually be prevention.